Good morning and welcome to the webinar. My name is Lauren. I am the Educational Services Manager here at Alzheimer's Orange County, and I will be your host today. Thank you for joining us for the unseen struggles of young onset dementia. Today, our presenter is Kim McRae. Before we begin, just a couple reminders. We will not be offering CE credit for this webinar. This is just a special informative presentation. The handouts were sent to you via email earlier this morning. I did get a few emails with the PowerPoints being kicked back to me due to their size. So if you did not receive it, please email me. My email is in the chat and I will resend it to you. Your mic and video are automatically disabled and will remain so throughout the presentation. Any questions that you have for the presenter, please type into the chat box located in the taskbar. We will save your questions and answer them at the conclusion of the webinar. And lastly, we ask that you please complete the survey at the end of the webinar, as it helps us to continuously improve our webinars and let us know what you would like to learn about in the future. So now I'd like to introduce our presenter. Kim McRae, FCTA, is a consultant, speaker, educator, and advocate. She is also an educator and mentor for the Eden Alternative. As an FCTA, family caregiver turned advocate, Kim comes to person-directed living and person-centered dementia care through a 12-year history as a family caregiver for 4 parents and in-laws. Since 2006, Kim has been involved with Pioneer Network and the National Culture Change Movement to improve quality of care and quality of life for elders and people living with dementia. She co-founded Culture Change Network of Georgia in 2008. Kim was one of the founding board of directors for the National Dementia Action Alliance, and since 2013 has been actively involved in the Georgia State Dementia Plan. She is currently a consultant on the 1.5 million CMP grant, a trauma-informed approach to improving dementia care in Georgia nursing homes, building resources for delivering person-centered care in Georgia nursing homes, and partnership between the Gerontology Institute at Georgia State University and CCNG. She is contributing to numerous boards, task force, and committees, developing programs, providing education, and advocating for changes that will improve the lives of elders and their care partners, and has been actively working to improve their quality of life for more than 20 years. So with all that being said, Kim, I will now hand it over to you.
That was a mouthful, Lauren. Thank you so much. I'm really glad to be with y'all today, and I know Sharon Hall she was supposed to be presenting with me today, and a lot of you might be familiar with Sharon and know her. She was unable to join us today because she's having some health challenges. So I know I cannot fill her shoes, but I'm going to do my best. So be patient with me as I'm trying to, step in for Sharon, who is a tremendous advocate for young onset dementia and particularly frontotemporal dementia. So I want to start by trying to figure out who all is with us today. And Lauren is going to help me with this, just so we know who's in the audience so we can try and speak more directly to you. So who are you? What kind of organization or what realm, what world do you fit in? If you could, please type you come from in the chat, and Lauren's going to try and scan this, look over it and give me kind of a feel for who we've got with us today. The numbers are coming fast, so I hope you can see it, Lauren.
Yes, we got a nice combination. We have family caregivers, several government entities, mental health clinic, adult day programs, assisted living, educator. We got the full gambit here with us
We have
today.
the full spectrum. Okay, so that's perfect. So I'll try to speak to the full spectrum, knowing that we're from all over the place. So I'm going to now tell you guys a little bit about me and how I got involved in this space. within a 5-year period, my husband and I took care of and lost his mother and his father and my father. And when my dad died, dad's on the left, I was 35 years old. He died suddenly. It was in 2001. And so at 35, I inherited my mom, Barb, second from the left, who had yet undiagnosed Lewy body dementia and progressive supranuclear palsy. And she was only 62 years old, and she already couldn't live by herself. And my dad was a retired physician, and we'd been trying to figure out what was going on with her, but he passed away before it had been figured out. So at 35, I wasn't working in healthcare. My background was consumer marketing and PR and advertising. So I dove headfirst into being a full-time caregiver and went through the whole diagnosis process, and over the years utilized most all of the goods and services that you all represent. And wearing my consumer hat, it was so hard and so challenging. And that's how I got into this, was to try and help make it better, easier for others. We moved mom. I live in Atlanta. And when dad died, she was living in North Carolina, where they had retired to. So I ended up moving mom to Atlanta, and we lived together for 4.5 years. And then she spent some time living in an assisted living. So that's kind of how that got started. And I got very involved in the world of long-term care and the culture change movement, which is focused on person-centered, person-directed care and support. And I co-founded the Culture Network of Georgia in 2008, as Lauren said. And when I first started speaking, I would be the only person in the room with no initials behind my name, because I wasn't a nurse or a doctor or, any of that. So I made my own initials up, and I called myself an FCTA, which is a family caregiver turned advocate. So y'all are welcome to use that if it's appropriate for you. So there. Now, what I want us to do is just get on the same page with some language and some definitions. So often, Alzheimer's and dementia are used the same way. They're used interchangeably. And we need to really realize that that's not true. And they have very different meanings. And did you know that 90% of the population is mistaken about this? This is a huge issue that really advances confusion out there, also among professionals. So it's really important for people to realize the difference between dementia and Alzheimer's. Alzheimer's is, of course, the most well known. It's what we always hear people talk about, but not everybody with dementia has Alzheimer's disease. And it's important also to realize that dementia isn't a specific disease. So dementia is not a disease in and of itself. It's a term that is used to describe symptoms. So that's really important. Symptoms of different cognitive function issues. So that is something that's important for us to realize. And the causes of dementia can come from all kinds of things, all types of brain changes that could be taking place. And there are various diseases and disorders and other kinds of things that can cause these symptoms. And some of them, if they're checked, they can be fixed or taken care of. Like, for example, if somebody has a thyroid issue, or if somebody is taking their medications incorrectly, or if their B12 is messed up, or if they have some different conditions that can be taken care of and fixed. So that's really important. But if you think of dementia as the umbrella, that really is helpful to help people understand how all of this fits together. It's really like saying cancer, you know, can and then all the different cancers. Saying Alzheimer's and related dementias, however, this is one of my little soapboxes, is like saying breast cancer and related cancers. It doesn't make sense. So we say dementia as the umbrella, including Alzheimer's disease. So if you just take a look here, this is an image shared by Tifa Snow. The different dementias fall within, and then some of the other types of dementias are listed on the right. So that is really helpful to know. And remember that different parts of the brain, they're all the different parts, and they control different things in the body. And this is really useful to know specifically when we're speaking about frontotemporal dementia, things going on in the frontal lobe. It's also important to realize that there are a lot of mixed dementias, and the awareness and acknowledgement of this has really been increasing lately. And it's estimated that more than 50% of people whose brains met the let's say it together, shall we? Pathological criteria for Alzheimer's had existence of one or more coexisting dementia. So you can't really box things in like we might have thought we could in the past. Now, as we're starting to talk and think about young onset dementia, you know, what we're used to doing is when we're thinking about dementia and Alzheimer's, we think about old people, and we think about people who are in the later stages, because that's normally what we see and often what we've been, shown in the media. And a lot of times people don't get diagnosed until late in their process, into their dementia journey, or if they have one of the diseases, their disease journey. So we're kind of used to having a visual image like this. And we think of things like older women, because the majority, a lot of people are women who have dementia. We think about people who are lonesome and forgotten. And we think about somebody who's maybe caring for a spouse, people who are forgetful and need assistance. And dementia is more common amongst older people, but it can happen to anybody. And that's what a lot of people don't really realize. Young onset dementia affects people under the age of 65. And it can even start as young as in the 20s. And that's really surprising to really so many people. But it usually shows up when people are in between their 30s and their 60s. So that's really important to keep in mind. So within those age ranges, people don't even have dementia or Alzheimer's or one of the other diseases that cause symptoms of dementia. They don't even have that in their mind as even a possibility. So that is just part of what we have to really open our minds to. Um, and the estimate is that there are 200,000 people with young onset Alzheimer's disease. But when we think about frontotemporal and Lewy body dementia and vascular dementia, the younger ones, the statistics, I don't think we even really know how many people there are. So always when you're looking at statistics, check and see whether it's saying, like here, Alzheimer's dementia versus, the way it's listed if it's talking about all dementias. And there's a lot of conflicting information out there about all the time about dementia in general, but particularly about young onset dementia. And so when people are even trying to consider this and think about it, it's hard to really get the root of what's going on. There's a low level of awareness, even amongst professionals. So a lot of the statistics are not correct. So these are the statistics that we know are correct. 100% of people with young onset dementia are younger than 65 years old. So they all are. Whatever that number is, the 200,000 plus the other dementias. And then there's this thing that happens called anosognosia, which is really hard to say. Sharon Hall had to teach me how to say it, anosognosia. And that's when people aren't aware of what's happening to them regarding like their disease process. So if I am having anosognosia, I don't think there's anything wrong with me. And if you're talking to me about symptoms that you're seeing, if you're my family care partner, for example, I just think you're crazy because I am not able to see them in my. And they say that 90% of people with young onset dementia have anosognosia. So that's really important to be aware of, as well as to be thinking about when you are trying to get at having somebody, taking somebody to the doctor and trying to get someone diagnosed. I'm going to pause just for 1 second because I have a ladybug that's about to walk right in front of my camera, and that would probably look really scary on screen. Okay, there you go. The other thing to think about as we talk about this today is that 33% of these folks under 65 no health insurance, and they have a child under 18 at home. So it's staggering when you really start to think about it. Now these are the types of dementia that are most common with younger people in the young onset world, right? So frontotemporal, and that is most common under 60. Alzheimer's disease has young onset. Lewy body dementia, which is what one of the things my mom had, has young onset. There's something called Korsakoff syndrome, which is when people lack thiamine, and that is a lot associated with alcohol abuse. There's Huntington's disease and Creutzfeldt-Jakob disease. So to get a little more in depth with the primary ones, with frontotemporal, it usually shows up during between the ages of 45 and 64. With Alzheimer's, the young onset can show up between 30 and 60. And there is the family familial gene that ties to some of this. Not all of it, but some of it. And then with Lewy body, it's usually seen in people that are 50 and older, but it can show up younger as well. And I want to point out that we don't want to confuse young onset with early onset. Young onset is 65, younger than 65, young onset. But early stage is when we're talking about people of all ages who are in their early process of their disease. For example, with Alzheimer's, early stage, mid stage, late stage. So we need to try and be clear about that language and how we use those words. Okay, y'all, there are so many challenges for people with young onset dementia. And there are so many things that people, we really haven't been taught to think about this. And the realities of what people with young onset are going through. So here, these people are young, and a lot of them have families. So the average age of diagnosis of all of them is 49 years old. So that's right when people are really raising their families, and they're in the midst of their careers. A lot of people end up losing their jobs and their income, which prevents them from being able to save money for the future and invest in retirement planning and continue growing in their careers. Because at 49, people haven't reached the pinnacle of their careers yet. A lot of what happens when people have young onset dementia is that they look normal. So people just can't figure out what's going on. And then once they are diagnosed, people just can't believe that a young person could have dementia. So that's an added difficulty that people have to navigate. And then there is a lack of knowledge amongst professionals, even the medical community. And we'll get into this more later, but it takes 4 years on average or more to get a diagnosis, and people end up having to see 5 physicians. That's like the average before they can get a diagnosis. So that's huge. The symptoms that show up are really different than what we are used to thinking about when we're thinking about older people. We're used to thinking about people, maybe old people with Alzheimer's, who have short-term memory loss and ask the same questions over and over and over because they have short-term memory loss. But the symptoms can be very different when people have young onset. And so we're not used to even being aware to notice it or to look for it. So that's why I'm so thankful we're doing this webinar today. As I said, it's not just memories. We there's so much more to symptoms of dementia than just memories. And some people with young onset don't even have memory loss. So it's important to be cognizant of that and realize that memory is not the only symptom. Now, when somebody is starting to try and figure out what's going on, this is kind of how the process goes. And Sharon, she has led support groups and different things for years from people all over the country. And this is really kind of a synthesis of what people go through. So people have changed personality often, and they can become aggressive. They could be, start blaming people. That's some of the symptoms. And if you're in a couple with somebody, you know, you might be saying, "This is not the person that I married." Um, and a lot of times people end up going to couples counseling or something like that. And people start talking about a divorce because this is not who I married. So that is a really big topic. And we've even done presentations to the mental health profession to counsel to be on the lookout for these things in counseling sessions. Um, if somebody's a parent of young children and they become aggressive and angry and loud, you know, that can really cause fear uh, for the children in that kind of a situation. People might start losing, not being compassionate and not having empathy. That can show up. People with frontotemporal dementia, a lot of times they start gambling or doing a lot of extra drinking or having promiscuous behavior and hypersexuality that might show up. Sometimes people with young onset crave carbs and sweets, and eating habits might change. So, what we all need to do if we're becoming aware of this, or if you're a professional working with people, is we need to urge everyone to start writing down what you're seeing. What are these changes? And don't feel like you are a tattletale or you're spying. What I did when I was trying to figure out what was going on with mom was I got myself a little notebook, and I just started writing down some of the odd things that I couldn't figure out. And then I really used it later to help explain what I was talking about with different healthcare professionals when I was trying to say, Mom, is just things aren't right. I couldn't figure out what was happening. Um, so so that's when whoever, family or friend, the people could be, it could even be work colleagues, the people that are closest to the person. And then we, the family, start trying to seek answers. And of course, there's Dr. Google, where we all go to start with, but then we go to primary care. As I already mentioned, maybe we end up in counseling, and nothing seems to work. We can't get get it figured out. And a lot of times people are misdiagnosed, um, or the diagnosis doesn't match the symptoms. And of course, doing our own research, Sharon Hall, her mother had Alzheimer's, and her husband's mother had what they used to call PICS dementia, which is now FTD, frontotemporal. So when Sharon's husband, Rod, started exhibiting all of these types of symptoms, she hadn't really even thought about, PICS, because it wasn't talked about much. And she got married to him as a second marriage. But once she started digging in and figuring out, and talking about and learning more about Rod's mother, her mother-in-law, and she started researching PICS and FTD, she diagnosed it. She said, this is what we're dealing with, and then found the right doctors to dig in and give a proper diagnosis. So we already mentioned that people end up seeing multiple doctors, and it can take a really long time. And there's a lot of frustration that people go through when they're trying to get to that point. So as people living with dementia ourselves, if we are going through worries about what's going on with our brain, if we're having brain changes, or if we are, looking into this for a family member or friend, somebody that we're close to, the main thing we have to remember is that we have to, learn to advocate and learn to not give up asking questions, and not necessarily to settle for the first thing that somebody might tell us. We have to dig in and do research and just not give up. So primarily the large university research centers have the best places to go, because not every doctor can know all of these things and be up on the latest dementia, information, particularly about young onset. And some of this stuff has been learned in the not so distant past. So finding the right people to have on your healthcare team is really important, and finding the right specialists. And when you get to them, being able to use your notebook where you've been writing down the symptoms, even if you think it's something weird, that can help them hone in on what type of dementia it might be. It can help give clues that can help point them in the right direction. And, you need to talk to a doctor or the healthcare providers by yourself, so you're not doing it in front of the person, especially if they have a no-signosia and they don't think that anything is wrong with them. Then don't be afraid to reach out and ask for that. And now these days, so much happens in a portal. Everybody's having to type in the portal, but make sure that you share what you need to share. And we have to just make sure we don't give up. We have to keep looking for the right team and the right answers. So seeing multiple doctors over 4 years is the average for a proper diagnosis. And think about this. So many of these people lose their health care coverage if they had it to begin with. These days, a lot of people are gig workers and things like that. And during COVID, there was all kinds of stuff happening. But in addition to that, a lot of folks end up losing their jobs and their health insurance. So that just adds to the problem if you're trying to go see multiple doctors and go get all these diagnoses, you know, and you don't even have insurance, you don't have the money to do it. So this is a big issue in our country. So people often are underdiagnosed and, as we've already said, misdiagnosed. And a lot of times they overlook dementia because they don't know to think about it. So a lot of women are told that it has to do with menopause. Uh, it could, or you're stressed, or you're depressed, you've got too much going on, you're stressed. That's what is causing all of this. Um, so this is a normal thing that happens to people. And again, the current healthcare system has just really not had the right enough, I'll say enough, if any, education about dementia in the ways that we all need to. Not only on the specifics of the dementias, but even how to interact with people that have dementia and their families and the healthcare system as a whole, and how younger people need to fit within that healthcare system. And I think, these statistics are pretty telling. Only 4% of social workers have had specialized, specific geriatric training. And when I say geriatric training, that's where dementia would be covered. So therefore, we're talking about younger than 65. So it wouldn't have even been covered in geriatric education. Same for all these groups on the list. So young onset dementia has just not made it into the curricula yet. And, we're still trying to get dementia and appropriate levels of dementia education into the curricula. So we just all need to be aware of this. And if you're on the policy side, these are things we need to keep in that hat. A friend, this is a picture of my friend Mike Belleville in Massachusetts. And this is really what happened to him with his whole diagnosis process. And I'm just going to read, uh, the way that he explained it to give an example. In the beginning, we were initially told that my symptoms were attributed to stress. Then we were told it was depression. Then we were told maybe it's Lyme disease. After all those things were ruled out, I then went through a battery of tests, including MRIs, neuropsychological exams, PET scans, multiple spinal taps, that finally led to the diagnosis of early onset Alzheimer's disease itself. And ironically, as crazy as it may sound, getting the diagnosis actually did offer a sense of relief, only in knowing that we finally knew what was wrong with me. However, 3 years after that diagnosis, we were actually told that I now have Lewy body dementia with Parkinsonianism. So that's what happens to people. And with my mom, with us, what happened was she was first diagnosed with Alzheimer's, and then 2 years, approximately 2 years later, it was changed to Lewy body dementia. And then we did a brain autopsy when she died for science. And in her brain autopsy, they found no Alzheimer's stuff of the proteins. They found definite um, Lewy bodies. They found a lot of tau, and they also found progressive supranuclear palsy that I had never heard of until I heard it when it showed up in her autopsy. So that is really what happens to people. The other thing is, this is happening when people are in their prime working years, you know, or in their earning and saving years, when you're trying to put money into a 401k or, all that stuff, making the right career moves and thinking about, what do I have to do now so that I can retire down the road? So these folks are in their prime working years, and a lot of times they get fired or lose their job, or they end up having to resign because they can't do their jobs. Because they're no longer able, because of the brain changes that are taking place. And this financial burden is just huge because these folks are younger. And it really can be totally devastating financially. So this is really an important statistic and way to look at this. The total lifetime cost of care for somebody with dementia in 2020 dollars was estimated $373,500. So 70% of the lifetime cost of the care, it's the families, that are doing unpaid caregiving and taking care of their folks and helping fill in the blanks where more money's needed. And it's, those numbers aren't including the fact that a lot of caregivers have to drop out of the workforce. Like, I had to quit work when I was 35 because it was just me. I mean, there was nobody else to do any of the stuff. And I couldn't be flying all over the country doing corporate marketing when I had to take care of mom and figure out her health situation and move her to Atlanta from North Carolina and all of that. Now, with FTD, this is really an aha. That's the most common form of young onset. The average annual cost associated with this, annual, we were just looking at lifetime, is $1,119,654. And that's nearly twice the reported annual cost for Alzheimer's. So this is, it's like double. And it really affects everything because people's future earnings go away and take a hit. A lot of times the family caregiver working as well so that they can take care of the person with young onset. So one of the symptoms with FTD, now that we're talking about money, one of the symptoms that people see is poor financial decisions. So making bad money choices, just going wild with when you invest money with investments and stocks, or we've heard a story of somebody went and bought multiple sports cars in one day and just, odd things. And of course, the the care partners of these folks are going through really stressful situations that take a big hit on their health. And then think about the folks that have kids, little kids, and what that impact is. When all of a sudden their daddy or their mama starts, you know, exhibiting symptoms of dementia, and what that's like for children, not just littles, but throughout the whole spectrum. And a lot of these young folks end up having to take on caregiver responsibilities as well to help take care of their person. It opens our eyes to what's really going on out there. And see, folks, to add to this, you know, so much of what is set up in terms of services and supports is for people that are 65 and older. That's the way the AAAs, the area agencies on aging, and so many of the programs are set up for older people, which means people with young onset aren't eligible for most of this stuff. So they're too young to qualify for these things, and they have to have a 2-year wait. They have to apply for disability, and then that average wait is 5 months for that. And then it's usually a 2-year wait for Medicare. So think of all the weird windows where they're not covered with insurances. They can't afford to continue to pay for COBRA, for example, if they lost their job. And then just start, if you're out there and you have a role where you're able to think about these things from a policy angle, these are some of the issues that we really need to think about. And we were talking just a minute ago about a lot of the types of things that can show up as symptoms of frontotemporal dementia, and some of the other early, the early symptoms of young onset. It's estimated that 20% of the prison population are people that have dementia and young onset because they're doing weird things and people don't know. That could be, risky behavior, and the first responders haven't been educated to even make this connection and connect this dot. And I'll just quickly tell you guys the story of Justin Davenport, and he's from Georgia. And his mom wrote these slides for us, so I'm going to read them. But this is the story of Justin, and he is one of those prison folks that I just was talking about. So this is kind of his path with dementia. So he was a hard worker, started working when he was 14 so he could buy a motorcycle, and he met Jennifer, his high school sweetheart, and they got married really young in 2005. And they had those two precious little girls in that picture, Haley and Ruthie, and they built their own house themselves, worked together and built their own house so they could raise those precious girls. And then there started being changes. And this was about, they got married in 2005. So about 10 years later, Justin started having changes and just not acting right. I'm doing air quotes there. And he became distant, and people thought it was his work schedule and he had too much work and stress at work, and they'd been building that home. And so people were writing it off to that. And then he started just kind of disappearing for periods of time. And he had always been a really mild mannered guy, but then he became angry and aggressive, and he exhibited behaviors that were odd for him. Marital issues started, and Jennifer and Justin separated. And this created more anger and odd behaviors. So he ended up getting really mad and angry that she divorced him, and it, added to and contributed to the situation. He ended up being fired from 2 jobs, and he was arrested 4 times, sent to 2 stabilization units, spent 9 months in jail, and 3 months in solitary confinement. And he was finally sent to the Georgia Regional Hospital in December of 2017 to the forensic unit. And he was diagnosed with major depressive disorder and schizoaffective disorder. And his parents, he's divorced, but his parents lived 2 hours away from this place where he was. And they would go visit him and take the girls. And they couldn't find any place that would take him. Nobody would accept and take him because of his diagnosis. But while he was living in that forensic unit, a psychiatrist really honed in and thought maybe it was a brain disorder, and had them do a CT and an MRI, and his frontal lobe was atrophied. And that is when he was diagnosed with frontotemporal dementia. So that, such a big part of his frontal lobe was gone. And that had been what was causing all of this, the behaviors, I'll say in air quotes. So they kept him there because he was getting such great care there, and there was no other place that would take him. So they kept him there until he was ready to go on to hospice. And then his parents prepared the home to bring him back home on hospice. And he, continued through till his end of life. And it was such an eye-opening shock and relief to know this was a disease that caused this. It wasn't a change in his personality. And that's part of what we all need to really be aware of and learn. And his wife actually came back in the picture to help care for him. And his 2 daughters and his mother, who was 50s when all of this started, she had to quit work to take care of him. But his mother and these 2 girls are now advocates for awareness of young onset dementia. So he passed away when he was 37 years old in 2021. And like I said, his family is still doing advocacy. It's a big story. But it just helps us be aware of what might happen. So we all need to work to do away with this stigma about dementia and all start talking about it. Everything about brain health, we need to open it up and talk about it the way we talk about other health conditions. And we know that over half of adults that are 55 and older who have reported subjective cognitive decline, where I'm noticing it in myself, for example, they haven't discussed it with their care providers. And if people have noticed memory problems or cognitive issues with functional, where they're having problems functioning on some things, 42% had not shared it with a provider. And so much of this is due to stigma. And that really prevents people from even taking the steps to go see a care provider to talk about it. Again, a lot of the folks have anosognosia, like we already talked about. So this stigma is something that we all have to constantly fight about against and be aware of in the whole dementia space. And of course, people are afraid of losing their 4Ds, driver's license, becoming dependent, and loss of dignity and fear of dismissal by your, where you work, as well as dismissal from friends and social connections. So Sharon says this all the time, and I think this is really our bottom line. When someone is not who they were, consider eliminating neurological causes first. So that's our bottom line. And we all just have to become aware and work together to help everybody whose life is touched by young onset dementia have a good quality of life. And there are some good resources. There's Lorenzo's House that does excellent work for families and children of people with young onset. So make note about Lorenzo's House. And then the Dementia Action Alliance has incredible resources about living well with dementia, particularly for the people living with the dementia themselves. So it's a great place for people with dementia to go to get involved. And Culture Change Network of Georgia, the organization that I work with, we've created a lot of little short micro learning videos, and they live on our YouTube channel. So type in Culture Change Network of Georgia and go to playlists and go to the dementia playlist. And you can find all kinds of, they're just a few minutes, 2 to 6 minute long videos that can be really helpful. And we actually have one on young onset dementia. It's just a few minutes long, and y'all are welcome to use it however you want to just kind of explain to people what it is. So hopefully you all be able to use different ways. So that's me and Mom together, Barbara, and that's my email address if you ever want to get in touch. And of course, I'm turning it back over to Lauren so she can tell you about the helpline.
Yes, thank you, Kim, so much for all of that valuable information. Just a couple reminders. If anybody has any questions, of course, reach out to Kim, or you can contact us at the Alzheimer's Orange County Helpline. And then we have our Q&A session now. So if anybody has any questions, please do put them into the chat box. I do have a few already.
Okay.
Is anosognosia, unawareness, constant or periodic?
I think, let's say it together. I mean, I had to literally have Sharon practice with me, and I would sometimes, if I was doing a presentation with her, I'd turn it over to her to say it. Anosognosia. people say it different ways, but that's how I say it. I think it's different for everybody. Um, I really do. I mean, there's a phrase, if you know one person with dementia, you know one person with dementia. And I know with a Lewy body, people can have big fluctuations in their functioning. They might be having and appear totally normal at one point and then, go down. Um, I know that some people can have awareness of things. So I can't say yes or no with that question. I think it just depends on the person. Sorry, I can't be more
Mm,
definitive than that.
that's okay. Um, and then would young onset dementia qualify a person for disability? And how would it be recommended for patients with this kind of diagnosis to pursue this resource?
Well, eh, I'm not an expert on the benefits, so I'm sorry Sharon isn't here, but I know that people can qualify for benefits, and I know through, you know, SSI, I mean, SSI, um, SDI, and Sharon's so good at this, I apologize, but but it takes a while, but know that there is a lot of advocacy to try and expand the benefits and coverage for people with young onset. So I would say the best thing is to try and talk to an elder law attorney, even though this is a young person, but elder law attorneys are totally in the know about these things, as well as be aware that not everybody in every AAA area agency on aging, they might not be totally up to speed on these things. So you just are going to have to start doing some digging, and you can reach out. What I'll do is, if anybody wants to reach out to some of Sharon Hall's past blogs and things, she has a lot of information there, and just start doing research. That's how this stuff works, and connect with people, try and find people who know, who've gone through it.
Okay, perfect. We did have someone who commented that they have experienced getting benefits utilizing the compassionate allowances on
Awesome.
SSA's website. So
Awesome.
I will go ahead and put that link in the chat for anybody that might
Great,
be
Lauren. Thank you.
interested.
And I'm
Yes,
sorry I'm not a benefit person. My mom died in 2009, so I haven't been tracking it.
it's
Um,
okay. Nothing's
and
more challenging.
different different states have different benefits and rules. So everybody needs to be aware of what is going on in your state as
hmm
well.
Okay. Do we have, it was only just a couple questions. I think you were so informative that most questions were answered throughout. But any other questions before we wrap up from anybody? It doesn't look like it. So thank you again, Kim, so much for joining us today and providing this wonderful webinar. And then thank you everybody for joining us today. For further information regarding resources, feel free to reach out to the Also See helpline at 844-373-4400. And again, please remember to complete the survey as you exit. So thank you everyone and have a great day.
Thank you. Thanks for inviting me
Of
to
course.
present.
Thanks.